Have you ever been told that the older you get, the more checkups you need? Doctors, advertisements, even family members might say, better safe than sorry. But here's the shocking truth. Once you cross the age of 70, not every test protects you. Some checkups can actually put your health at risk, leaving you with more stress, more side effects, and sometimes even treatments for problems you never really had. Imagine going in for a test, only to walk out with a false alarm that leads to more scans, biopsies, or even surgeries that may do more harm than good. That's why today we're exposing 7 common health checkups you should think twice about after 70. These are not about neglecting your health. They're about choosing wisely, protecting yourself from unnecessary harm, and making sure your golden years are filled with peace of mind rather than medical anxiety. Let's dive into the first one. And trust me, this may surprise you. Full-body scans like CTs and MRIs sound like the ultimate preventive tool, right? The logic is simple. Scan your whole body and you'll know if anything is wrong. But here's the problem. These scans are so sensitive, they often pick up harmless little spots, nodules, or shadows that would never have caused you harm. Yet once they're discovered, doctors feel compelled to investigate further. That means more tests, biopsies, and sometimes even surgery for something that didn't need treatment in the first place. Instead of reassurance, you're left with stress, worry, and in some cases, real physical harm. The truth is, unless you have strong symptoms or specific risk factors, full-body scans after 70 can do more harm than good. A smarter approach is to focus on targeted testing, only when there are real symptoms or clear reasons for concern. The second one is for men. Prostate cancer screening, specifically the PSA blood test. Now, the PSA test has been one of the most controversial screenings for decades. At younger ages, it sometimes helps catch aggressive cancers early. But after 70, most prostate cancers grow so slowly, they'll never affect your lifespan. The danger is in what happens after a high PSA reading. Biopsies, surgery, radiation, or medications that carry risks like incontinence, impotence, and infections. Many men end up treated for cancers that would never have caused them harm. So, after 70, routine PSA screening is usually more harmful than helpful. The safer route is to discuss your family history and symptoms with your doctor. If you don't have signs like frequent urination, blood in the urine, or severe discomfort, skipping this test might actually protect your quality of life. Moving on to the third checkup. Colonoscopies. Colon cancer is a serious concern in middle age, and screenings save lives. But after 70 to 75, the balance changes. Colonoscopies are invasive, and they carry risks of bleeding, bowel perforation, and complications from anesthesia. If you've had clear results in your 50s and 60s, repeating colonoscopies in your 70s often adds more risk than benefit. Studies show that for people over 75, the harms usually outweigh the gains. Instead of another invasive scope, a stool-based test can be a much safer alternative to check for hidden blood or changes in your colon. The key message here is that not every test designed for your younger years continues to make sense in your older years. Let's turn to women for the fourth one. Mammograms after 75. Breast cancer screening saves lives, no doubt. But after a certain age, mammograms often create more fear than benefit. Why? Because the chances of false positives increase. That means the machine may detect something that looks suspicious but is harmless. Once that happens, you're drawn into a whirlwind of biopsies, surgeries, and sometimes chemotherapy or radiation that may never have been necessary. And many breast cancers discovered after 75 grow so slowly they never affect overall survival. If you're in your 70s or 80s and don't have strong risk factors like a family history or genetic mutations, routine mammograms may no longer be the right choice. Instead, it's safer to stay alert to changes in your breasts. Report them to your doctor and focus on maintaining overall health. Now, the fifth checkup is one that many women may not realize. Cervical cancer screening with pap smears. These are vital in younger years, especially before 65. But if you've had regular normal results throughout your life, the risk of developing cervical cancer after 70 is extremely low. Continuing pap smears after 70 can be uncomfortable and stressful without offering real protection. The medical community agrees that if your results have been clear in the past, you can safely stop pap smears after 65. So if you're still being told to do them at 70, it's worth asking whether it's truly necessary. Let's pause here and look at the bigger picture. Notice the pattern? Most of these tests were life-saving in your younger years, but after 70, the equation changes. The risks, false alarms, unnecessary treatments, and complications often outweigh the benefits. And it's not about ignoring your health. It's about making smart choices that protect your well-being. Now, let's move on to the last two checkups in part 1 that you should think twice about. The sixth one is bone density scans done too frequently. Osteoporosis is real, and, many seniors are at risk of fractures. But repeating bone scans every year or two doesn't make sense. Bones change very slowly, and once you know your risk, repeating the scan too often usually doesn't add new information. The danger comes from overtreating based on tiny changes in scan results. Some medications prescribed for osteoporosis come with severe side effects: jawbone problems, unusual fractures, and digestive issues. Instead of relying on constant scans, a safer approach is lifestyle. Eat calcium-rich foods, take vitamin D, practice safe weight-bearing exercises, and work on balance to prevent falls. That will protect your bones more than another scan will. Finally, the seventh checkup is annual heart tests like EKGs and stress tests if you don't have symptoms. These are very tempting, because honestly, who doesn't want reassurance about their heart? But here's the problem. If you don't have chest pain, shortness of breath, or irregular heartbeat, these tests often pick up meaningless changes that doctors feel they must chase. This leads to stents, surgeries, or medications that carry their own risks. For seniors over 70, unnecessary heart testing can actually create more danger than skipping them. Instead, the better focus is on lifestyle. Control blood pressure, keep cholesterol in check, stay active, and eat heart-healthy foods. If symptoms appear, then yes, testing is crucial. But if not, it may be safer to skip. So here's the key message of part 1. Health after 70 is not about piling on more tests. It's about choosing wisely. Full body scans, routine PSA tests, repeated colonoscopies, unnecessary mammograms, pap smears, frequent bone scans, and symptom-free heart stress tests are all examples where the risks can outweigh the rewards. The first step is learning how to have the right conversations with your doctor. Most seniors don't realize this, but you have the full right to ask a doctor why a test is being suggested. You can say, "Will this test help me live longer, feel better, or prevent something dangerous?" If the answer is, kind of vague, or if the doctor admits it might not change the treatment plan, then the test may not really be worth the risk. A lot of tests are recommended out of habit, or because of guidelines that don't always take age into account. Medicine is definitely not a one-size-fits-all process. When you're over 70, your body just doesn't respond to surgery, medication, or radiation in the same way it did when you were 50. That's why, honestly, questioning and understanding the purpose of every test is so important, because unnecessary tests often lead to unnecessary treatments. And treatments at this age can actually be more dangerous than the condition itself. The second step is to look at safe alternatives instead of invasive or high-risk tests. For example, instead of repeating a colonoscopy when you're over 70, you can use stool-based tests like FIT or FOBT. These tests are simple, non-invasive, and still effective at detecting early warning signs. Instead of running to get another bone density scan every year, put your focus on daily habits. Walk for 30 minutes. Add balance exercises like yoga or Tai Chi. Eat foods rich in calcium such as leafy greens and fortified dairy. And make sure you're getting enough vitamin D from the sun or supplements. These steps protect your bones more than another test can. When it comes to your heart, instead of unnecessary EKGs or stress tests without symptoms, the best prevention is regular blood pressure monitoring, checking cholesterol, and maintaining a healthy weight. Heart health is more influenced by your lifestyle. Avoiding processed foods, cutting down on salt, staying active and managing stress, than by taking yearly heart tests when no symptoms are present. Prevention is not about machines. Prevention is about daily choices. Now, let's shift to the essential checkups you should never skip, because balance is important here. Even though we've said to avoid certain tests, there are some screenings and health checks that become more important with age. For example, blood pressure checks are non-negotiable. High blood pressure is often called the silent killer because it doesn't always cause symptoms, but it raises the risk of strokes, heart disease, and kidney damage. Monitoring it regularly can save your life. Blood sugar checks are also vital because type 2 diabetes often sneaks up silently and can damage the eyes, nerves, and kidneys if not controlled. Cholesterol levels should still be checked, because managing them through diet and sometimes medication can significantly lower heart attack and stroke risk. Another category of essential checkups are vision and hearing exams. Losing eyesight or hearing might not sound as dangerous as heart disease, but these senses are directly connected to independence and quality of life. Poor vision increases fall risk, and poor hearing is strongly linked to memory problems and even dementia. By protecting your eyes and ears, you're also protecting your brain. And let's not forget vaccinations. Flu, pneumonia, and shingles vaccines are especially important after 70, because infections that may seem minor in youth can become life-threatening in older age. These are the kinds of health actions that make a real difference. Another key element to focus on is reducing the anxiety that comes from overtesting. It's really important. Many seniors fear that if they don't do every possible checkup, they'll miss something dangerous. But the truth is, your body gives you warning signals. Instead of scanning and testing endlessly, learn to listen to your body. Pay attention to sudden changes in energy, unexplained weight loss, persistent pain, new shortness of breath, or bleeding that doesn't make sense. These are the red flags worth investigating. On the other hand, if you feel active, strong, and stable, don't let unnecessary tests convince you something must be wrong. Health is not defined by how many scans you take. It's defined by how you live each day. We also need to talk about the financial side, because this matters just as much as the medical side. Many seniors live on fixed incomes, and repeated unnecessary tests can drain savings quickly. Every dollar spent on a test that isn't needed is a dollar that could have gone into better nutrition, a fitness program, or activities that bring joy and mental health benefits. Imagine the difference. Spending hundreds on a scan that tells you nothing useful, versus spending that same money on fresh foods, supplements, or even something as simple as a dance or yoga class. The second option not only improves your physical health, but also your emotional well-being. Health is about more than test results. It's about living fully. Now, let's address one of the most dangerous outcomes of unnecessary testing: overtreatment. This is the silent threat that, honestly, many seniors don't even realize is out there. Overtreatment means you undergo surgery, radiation, or take strong medications for something that was never truly a danger to your health. For example, treating a slow-growing prostate cancer or a harmless lung nodule may do more harm than good, because the treatment itself comes with risks: bleeding, infections, permanent side effects, and long recoveries. Seniors are more vulnerable because the body doesn't bounce back as quickly. By avoiding unnecessary checkups, you're not just avoiding the test. You're avoiding a potential cascade of treatments that could lower your quality of life. The goal after 70 should be independence, mobility, and joy, not endless recovery from procedures that may not have been necessary in the first place. So, what is the bigger picture here? After 70, health isn't about chasing every possible disease that could exist in the shadows. It's about protecting the body you have, preserving your independence, and enjoying the years you've earned. Too many tests create fear, while wise choices create peace. So, it's time to shift your focus from wondering, "Am I missing something?" to really asking yourself, "Am I living well each day?" The true foundations of longevity are actually pretty simple. Nutritious food, daily movement, good sleep, strong social connections, and a calm mind. These are the things that keep you strong, not just another invasive test that ends up telling you what you already know, that you feel healthy. By saying no to unnecessary screenings, you are in fact saying yes to freedom, confidence, and control. So, let's put it all together. The 7 checkups you should avoid after 70 are full-body scans, routine PSA prostate screenings, colonoscopies after multiple clear results, mammograms past 75 without high risk, pap smears after a history of normal results, frequent bone density scans, and symptom-free heart stress tests. By skipping these, you protect yourself from false alarms, overtreatment, financial drain, and unnecessary stress. But at the same time, you must continue with the essentials: blood pressure, blood sugar, cholesterol, vision, hearing, and vaccinations. Pair these with a lifestyle that supports your health and you'll be stronger than any test result. That's the secret to thriving after 70. And now, as we wrap up, let me ask you this. Did this video give you clarity about which checkups to avoid and which to keep? If it did, don't keep this wisdom to yourself. Hit that like button, subscribe to the channel for more senior health tips, and share this video with your family and friends. You never know, someone you love may be worrying about unnecessary tests right now, and your share could give them peace of mind. Remember, true health after 70 isn't about piling on more checkups. It's about making smart choices, living fully, and embracing the freedom you've worked so hard to enjoy.